last recording for chapter 23. So, sexual assault, definitely not anything that we want to have to talk about, but unfortunately, sexual assault and rape are far too common. 1 in 5 women has actually reported being raped. 1 in 4 women will be sexually molested, often before the age of 12. So, it's very likely that people that you know right now may have been a victim of either sexual assault or rape, whether you know that they have or not, but it's very, very common. Oftentimes, we face some pretty complex issues when we're called to um, assist or evaluate a sexual assault victim. Issues range from just the obvious medical issues that can occur to serious psychologic and then oftentimes legal issues as well. Oftentimes, police are going to be called to gain evidence, and oftentimes we are the first, sometimes only witness of what's going on right after the sexual assault. Oftentimes we may be the actual first person that the victim has contact with after the encounter. So how we manage the situation may have lasting effects for both the patient and then for us as well, but it also makes us a key witness. So make sure that you exhibit professionalism, have a little bit of tact, kindness, sensitivity, kind of let her set the pace for how you're going to talk, how you're going to um, approach her. She may not want to be touched. She may not really want to talk about it, and you don't have to force her to talk about it. That's what the police are for. You are predominantly there for the medical side of it. If she wants to talk, make sure that you document everything as thoroughly as you possibly can, because your report is going to get called into court should it go to court. So just make sure that you cover all of your bases. Be aware that there are oftentimes drugs that are used to facilitate sexual assault or rape. If the patient has an inability to remember everything, that should definitely create some suspicion. If these drugs are still in a patient's system, you may see things such as hypotension, bradycardia, abdominal complaints, difficulty breathing, seizures, coma, and then depending on what they used, you can even have a patient die because of those drugs that are used to facilitate. Like I said, you can generally expect law enforcement to be involved. Attempts to immediately gather a detailed report may cause the victim to just completely shut down. So, like I said, let her kind of guide you as to how she wants to talk and how much information she wants to give. If possible, give the patient the option of being treated by an EMT of the same sex, so female for female patient, male for a male patient, because yes, males can be sexually assaulted and raped as well. It's less common, but it still happens. Our focus should be on the medical treatment of the patient themselves. Are they injured? Are there any life-threatening injuries present? Does the patient have any complaints of pain? Then we're going to worry about the psychologic care of the patient. Don't pass judgment first and foremost. You don't know what their story is. And protect the patient from judgment of others on the scene. Next, we're going to try and preserve evidence. Don't cut through any clothing if you can help it. Try and keep the clothing together. Don't throw anything away from the scene. Everything stays. Place blood-stained clothing and anything else that could be used as evidence in separate paper bags. We want to use paper bags because it allows for the moisture to breathe. If you put something that's wet, has blood, has body fluids on it in a plastic bag, it has the ability to mold or to get just something on it that shouldn't be there, and it can give false results. So paper, everything goes in paper bags. It may be necessary for you to persuade the patient not to clean herself. Oftentimes that's the first thing that a victim wants to do is take a shower and quote unquote wash the experience off, but doing so can definitely destroy evidence. You want to discourage them from going to the bathroom, from changing clothes, and then from rinsing out her mouth, because those are all things that are going to be taken for evidence. She's going to be photographed and examined by nurses trained in sexual assault examination. So try and preserve everything that you can on scene and then go ahead and transport in. You can offer to call a local rape crisis center for the patient. They may be able to give the patient some advice, or they've been trained to talk the patient down. So that may help on scene if at all possible. Sometimes the patient's going to be fine overall and be very willing to go with you and talk to you, but that's definitely not the norm. You want to be very careful and thorough in your patient care report, because again, it's a legal document. It's very likely that it will get subpoenaed into court. Keep the report concise, but make sure that you record anything that the patient says in her own words. You don't need to insert your opinion whatsoever. Use quotation marks when reporting patients' versions of the events, because they may decide to talk to you. They may decide to tell you everything. So quotation marks for sure. Focus on the facts. Bear in mind that rape is a legal diagnosis, not a medical diagnosis. So sexual assault is typically the words that we're going to use. But make sure that you're very, very careful, because somebody's going to read that. Here are kind of the treatment principles for sexual assault. It's table 23-1 in your book. I'm not going to read this to you, but I would recommend that you go ahead and look over it for yourself. Otherwise, this is the last recording for chapter 23.